Thinking of switching from Zep Bound to Wegovy? You're not alone. Many patients are being moved because of insurance coverage, availability, or personal preference. But here's the thing, these medications are not identical, and switching the wrong way can lead to side effects, setbacks, and confusion. In this video, we'll talk about everything you need to know if you're making that transition from dosing to side effects to what questions to ask your doctor. Quick overview: Zepbound, which is tirzepatide, Wegovy, which is semaglutide. Both are GLP-1 based weight loss medications, but Zepbound is a dual acting GLP and GIP, while Wegovy is just GLP-1. The FDA has approved both of these medications for weight loss, but different brand markers, Eli Lilly versus Novo Nordisk. Let's talk about why people are switching. Insurance coverage is the number one reason. Shortages at pharmacy. You may be having side effects from one medication and then need to switch to another, or your doctor may recommend it. Sometimes people switch if they're not losing from one medication, they'll switch to the other kind. Zepbound is a little bit newer. It's dual agonist and tends to produce slightly greater average weight loss in clinical trials. Wegovy is a single agonist and well studied, proven long term benefits include heart health, dosing differences. Zepbound is 2.5 to 15 milligrams weekly, where Wegovy is 0.25 to 2.4 milligrams weekly. Potency is not milligrams per milligrams. A 10 milligrams Zepbound shot is not equal to a 2.4 milligrams of Wegovy. Talk to your doctor. Switching isn't a one size fit all. Is there a washout period, a waiting period? Usually not required. Most people switch the very next week. You do need to usually start over at the lowest dose to prevent side effects. Some doctors will switch you to the second dose if you're on a higher dose of one. That's between you and your doctor. And sometimes your side effects can differ because of this. Also, appetite control may feel slightly different. Nausea, vomiting, diarrhea, constipation are all classic GLP-1 side effects and may reappear when switching. Why? Because your body has adapted to a different molecule and dosage. Tips: eat slowly, eat smaller meals, stay hydrated, add electrolytes, focus on protein and fiber. This will help avoid blood sugar dips and spikes. Avoid alcohol and greasy foods during the titration. If severe symptoms come, please call your provider. Don't just tough it out. Many switches are driven by coverage. Some plans cover Wegovy but not Zepbound or vice versa. Prior authorization is usually required. Be ready to provide BMI documentation, history of obesity, and weight related conditions, notes on prior medication trials. There's out of pocket costs. Wegovy's price could be up to $1,300 a month. There are saving cards that will make it between $25 and $100. And there's also Novo Nordisk has a program called NovaCare, which you could get it in vials. Same type of thing with Zepbound. They do have discount cards, and there's Lilly Direct also in vials. Some people report more hunger when they switch to Wegovy since Zepbound's GIP action may reduce cravings differently. Weight loss may slow temporarily during transition. Don't panic. Your body is still losing weight on Wegovy. Focus on behavioral consistencies. Stick to that meal planning, protein goals, hydration, and movement. Give it at least 8 to 12 weeks before deciding that one of the medications doesn't work for you. Wegovy is proven to reduce heart attack and stroke risk in patients with cardiovascular disease. Studies on Zepbound are ongoing, but it looks very promising. If you have diabetes, Switching may require reevaluating your blood sugar management. Labs also may need to be repeated. A1C, cholesterol, and liver function, vitamin B12, and vitamin D. Don't forget mental health. Switching meds can affect energy, mood, and body imaging. Here's some questions to be asking your doctor. What starting dose of Wegovy should I begin with? How will this affect other medications, especially diabetes medications? Should I expect different side effects? How will this measure me progress? Scales, labs, waist size, blood pressure. What's the plan if Wegovy doesn't control appetite as well as Zep Bound? Switching between GLP-1 medications isn't unusual, and with the right plan, it can be smooth and successful. Expect some dose adjustments and side effect managements the first few weeks. Be patient with your progress. Weight loss is a marathon, not a sprint. Always lean on your healthcare team. If you're considering the switch, let me know in the comments. What's your biggest questions and fears about moving from Zepbound to Wegovy? I'd like to hear about it. Hear about your thoughts. Let me know in the comments.